Bismillahirrahmanirrahim. With this, we come to our second session, which is about the waste segregation. And in this session, we'll see how the waste is segregated and at the health facility level. So let's discuss the waste hierarchy. So what is the waste hierarchy? So when we look at the healthcare waste in the healthcare settings, so first thing is this: to prevent and minimize the waste. It's very important to minimize both the general and infectious waste as much as is possible. Whatever you can reuse or recycle in the general kind of waste, because for syringes and others you can't do these things, but to reduce the bulk of the hospital generated waste, what you can do is to minimize the non-risk or general waste, such as cardboards and the boxes. So you can use box for one purpose and then use for the same cardboard box for other purpose as well, or modify it for some other. So that's you. So as to you are able to reduce the overall bulk of the healthcare waste and the general waste coming out of the hospital. And by this doing, you can reduce the size of overall waste. And then when you have that for the infectious waste, you can send it to the incinerator, and then you can also do the heat recovery out of it. So that's another environment friendly kind of thing. So why we are talking about the waste hierarchy is to comply with the environment protection or environmental health laws, which are not only at the national level but also at the global level. And if the incineration is not proper, or incineration is not being done at the proper temperature, or you don't have the incinerators, then there are the options to use autoclaves and other methods which are the alternatives to the incineration. And then the residues can be sent to the landfill. So that's the hierarchy. So you try to do the minimize and reduce the overall bulk of the hospital waste. Majority of it, which it is the general waste, and a small amount, around 20%, is of infectious waste. That infectious waste can go to the autoclave or the incinerator with the heat recovery, and then go to the landfill. All the ashes which are collected from the incinerator, they can go to the landfill. What is waste segregation? So waste segregation is simply separating the risk waste from the non-risk waste or the general waste at the point of its production. So where it is being produced or at the point of its source, it is separated at the same point. So if you have at the bedside of the patient, you have a black bin, a red bin, and a yellow bin, which we call as the 3-bin system. So all the swabs, blood-soaked swabs, will go into the red bin, and the syringes and others, they will go into the yellow bin or the yellow box, which is non-puncture one, and the general waste will go into the black one, which we'll be talking about those three type of bins in the next slides. So in those bins, they have the inner lining of non-punctured kind of bags, which are labeled. Which are properly labeled and regularly emptied and replaced. And the sharps, they are collected into the marked metal containers. Radioactive, pharmaceutical, and chemical waste should be collected specially and in a very specialized manner in a special bins. And notices should be affixed for visitor on procedures to dispose of non-risk waste. So because in our setting in Pakistan, we receive a lot of visitors in the hospitals. So whenever a patient is admitted to the hospitals, then the families of that patient, they come to see him, and they bring along them a lot of food stuff and juices and milk and everything. And all that non-risk kind of a general waste, it is dumped into at the bedside or the same place. So there should be notices fixed for the visitors on procedure and disposing of the non-risk waste, pointing towards the black or white bin in which they have to dump it. So this slide shows the bin color coding for segregation of waste. So if you look at the waste type, and then the next column shows the risk waste, sharps, and the non-risk waste. So as we talk about the risk type, so for yellow is the risk waste. For the sharp, it goes into the yellow one, and non-risk goes into the black one. And it should be strong and leak-proofed. Yellows, all risk waste goes to the incineration and then to the secured landfill. And sharps, they also go to the incineration. Encapsulation is one of the processes, or the secured landfill. And non-risk waste, it always goes to the landfill. So for the sharps and the needles and syringes, sometimes what they do, that for the needles and sharps which are discarded, they put it into a cement box, which is in a box in which those needles, cut needles, and the sharps, they are put in, and then cement is added to that, and that process is known as the encapsulation, and then it is buried into the land. So this picture, this shows the 3-bin system in which you can see white, red, and yellow bins, and you can see the notices affixed above them, along with one yellow box over the trolley with a small red box. So I just go through from the left side to the right side, and that small box, you must have seen it. It is the needle cutter, and it is present at the nursing station or the patient site where the injections are being administered, and also in the labs. Along with that is the small yellow container, and that small yellow container contains for syringes and other materials which are put into them, because you see, you cut the needle with a red one, and then you put the plastic one into the yellow box. And on the floor you can see the yellow, red, and the white one. The white one is for the non-risk waste. All the infectious waste that goes into the red bin, and all the syringes and other things, they go into the yellow one. Let's talk about the waste collection. So waste collection should be according to the plan, and that plan comes from the waste management plan which is formed by the waste management committee of a hospital. So I believe that you understand what a waste management committee is. So that is according to the hospital waste management rules. Every hospital must have a waste management committee headed by the medical superintendent of that hospital or CEO of that hospital, and it must have one of infection control nurse or anyone who has the specialization or training in infection control prevention. He or she should be the part of that team. And it has all the head of departments, and that's a proper team. So that team develops and tests a plan, dry runs a plan, and that plan is then there. So waste is collected according to that plan, and that plan can be that how many times a day the waste will be collected from the wards and operation theaters and OPDs and emergencies and everywhere from where the waste is being generated. So whoever handles the waste must have proper special clothing with proper personal protective equipment. And you can see this picture in which you can see 2 persons wearing proper shoes. You can see they are thick sole shoes with extension up to their knees. They have proper aprons, face mask, and the head cover, and they have heavy gloves with which they are carrying that waste bin, which is a red bin, and of course that bin might be having infectious waste in it, so that they are taking all the care for their protection. And for that waste collection, all the labeled and sealed bags are used usually, and on every bag it is written that what is in it and where it is going to go. So if the yellow bag is going to go to the storage place, so its destination will also be written over there, and the date of collection, time of collection is also important. So whoever collects those bags, he registers the time of collection and disposal on those bags, and those bags destination is also written on it. And they have to replace the bags in the bins on time. It shouldn't be like this, that the bin is left empty out of the without any bag. And whenever those bags are filled, so you just seal them when they are 1/3 space is left. So it's never filled up to the mouth of the bag. So 1/3 space should be left where you tie up the bag and then it is transported, and it is done so that the bag is not burst on the way of transportation. That brings us to the waste transportation. So waste transportation is of two types. One is the on-site transportation and other is the off-site transportation. For on-site transportation within the facility, trolley which is clean and stable and easy to load is used, and usually it is of yellow color most of the time. Sealed bags are transported, no unsealed bag is transported. These trolleys, they have to follow the direct route. So there shouldn't be many turns around or corners or where there is no light, so that there is no chance for anyone to approach that trolley which has that infectious waste in it. So, and the trolleys are not going to stop on the way. They will go from the shortest route as quickly as possible to the storage facility. For off-site transportation, all the staff, they wear protective clothing, and transportation is documented, time schedule is followed, and separate disposal of yellow waste is done. If it is taken to the incinerator or some other facility, because you see, there is one model of healthcare waste management which is known as Bangalore model, in which one hospital has the incinerator and all the facilities for the final disposal of the hospital healthcare waste, and other hospitals, they send their waste to that facility, so that you don't have to put so many incinerators at so many places, because incinerators, if they are running suboptimally, they have their own hazards of producing dioxins and furanes, which are very hazardous gases for the health of the human life. So for that, of course, when the healthcare workers, they are transporting those bags to the off-site, they should be wearing complete personal protective equipment, which we have shown in the last slide. So this, the next picture depicts the collection and transportation of waste, and you can see that the waste is being transported in the yellow trolleys to the incinerator, and you can see the incinerator at the back of the yellow bags lying on in the door of the incinerator. So that all the waste was brought in those that big yellow trolley, and one thing you might notice here, that both the persons who are bringing this trolley to the incinerator, they are not wearing personal protective equipment properly. So this is one of the that shouldn't be done. That shouldn't be like this. So they should be wearing. Still, it is a very metal kind of trolley, but they should be wearing the personal protective equipment as per procedure. For waste storage, separate facility for yellow big waste is designated, and it should be within the hospital premises, and it should be close to the incinerators and away from any food source. So it shouldn't be near to canteen or where the food is being served. So it should be away from any food storage areas. It should be large enough to contain all the risk waste, and it should be easy to access to the staff, but secure from unauthorized persons and animals and rodents, dogs, cats, mice, etc. And it should not be stored for more than 24 hours or other than the yellow bag waste. So that should be the thing, that within 24 hours it should be given its final disposal kind of thing. So this picture, it shows the yellow room, which is a storage room, and you can see the two employees standing in front of it. It is painted yellow, and and this is just for 24 hours. You can store the yellow bags here. So with this, we come to the end of this session, and we'll move to the next session again. Thank you.